My name is Monica Tarrant, and this is my head-to-toe assessment for my nursing assessment class for the Maryville University. This is my cousin Sandra, who is going to be my student for today. Before she came in, we did a full set of vital signs, which were normal. I checked her height and weight, which is 5 feet 8 inches, and she is 150 pounds. That gives her a BMI of 23. I also asked her to empty her bladder, which she did. And we did the Snellen chart for far vision and the Rosenbaum chart for near vision. Now we are ready to do our assessment. Okay, so now I will start by looking at her face and her head, which is normal cephalic. I've checked her face to make sure that see if there's any lesions, no bumps, no bruises, and so far everything looks good. Her eyes are evenly placed, her eyebrows are evenly placed. Now I'm going to be palpating her scalp, and I'm palpating her scalp for tenderness, checking for any nodes or lesions, and none is present. I also check to see how the scalp moves freely over her head, and it does. And while I'm at her head, I'll be checking her hair. I check the hair for texture, which is soft and fine. I check for any sign of alopecia, which none is present. And I also check to see how the hair moves and there is no shedding while I'm feeling her hair. Now next I'm going to be checking the bones of her face. I'll be checking the bones for tenderness. And there is no tenderness, is there?
No.
No tenderness. Okay, so the next thing I'm going to do, I'm going to be checking her jaw. I'm going to open her mouth up close. Okay, so while I'm checking the temporomandibular joint for any clicks, and I feel the joint, it moves freely. Okay, the next thing I'm going to be checking her eyes. I'll palpate the lacrimal glands. And I'm also going to be looking at her eyebrows. They are evenly distributed, symmetrical. Her eyelashes are outwardly placed, and they are the hair is evenly distributed. And then next thing I'm going to be looking in her eyes. Okay, so we're going to be checking your eyes. I'm looking at the conjunctiva, which is nice and pink, and the sclera is white. Conjunctiva is nice and pink, sclera is white, and slightly moist. Okay, no sign of infection there, no redness. Okay, so now I'm going to be doing a test to ask you to, I'm going to look at the light, the direct and consensual movement of your eye as it responds to light, okay? So I'm going to do direct, and this is consensual. Do the other side, we're going to do direct light, and we're going to do consensual. All right, so the next test we're going to do is what we call the cover and cover test. I'm going to ask you to put one hand over your eye, cover your right eye. I'm going to ask you to just focus on the tip of this light. Okay, uncover. Do the same for the other eye. Focus on the tip of the light. Okay, uncover. All right. So the next test we're going to do is to check your cardinal points of gait. I want you to look at the tip of this pen, and you're going to follow with your eyes without moving your head. Okay? So, okay, good. There I'm checking to see if your eye has any jerky movement, which is called nystagmus. They move well, so there's no problem there. The next test we're going to do is what we call the confrontation test. Okay, so I'm going to be asking you to cover your right eye. I'm going to cover my left eye. You're going to follow my hand, and when my hand comes in, my fingers come in your peripheral vision, you say now, okay?
Now. 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 Now.
Okay, good. So we're going to do the same thing with the other hand.
Now. 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 Now.
Okay, so that's good. So I've checked your peripheral vision, I've checked your ocular movement, and that means we have just tested your cranial nerve, number 3, 4, and 6. Okay?
Okay.
All right, the next test I'm going to do is with your ears. First, I'm going to observe your ear, look at them, see they're evenly placed, symmetrical. I'm checking the auricle of your ears. There's no swelling, no lumps, and I don't see any lesions. Same with the next ear. I'm checking the earlobe. No swelling, no lesions here. So now I'm going to use my stethoscope. I'm sorry, my otoscope, and I'm going to be looking inside your ear. All right, so by looking in the ear, I see the auditory canal is lightly pink, no sign of, no lesions, no redness, no bumps. Okay, the hair inside your ear, they're evenly distributed. Okay, I'll do the other ear. Okay, the same thing for this ear, the auditory canal is nice and pink, no swelling, no lesions, no bumps, and the hair inside is evenly distributed. Okay, good. All right, so another test I'm going to do for your ear is what we call the Weber test. I'm going to use my tuning fork. I'm going to strike it and put it on top of your head. Tell me if you hear the sound in one ear, the right ear, the left ear, or both. Okay?
Both.
Okay, very good. Next, I'm going to strike my tuning fork. I'm going to put it on the mastoid bone. And you tell me if you hear it. Whenever you stop hearing it, you're going to indicate by just raising your hand. Okay? Okay, I'm going to put it beside your ear. So when you're not hearing it. Okay, very good. This is a good test for you, for your hearing, because the ear conduction is twice as long as bone conduction, and you seem to be hearing very well. Okay, the next thing I'm going to do is what we call a whisper test. I'm going to come behind you and whisper a word, and you let me know what the word is.
Tip-top. Hot shot.
Okay, good. So we just completed your hearing test, and we have tested your cranial nerve, number 8.
Okay.
All right. So next thing I'm going to be assessing your nose. I can see your nose is in the center of your face. It's symmetrical. I see no lesions there. So now I'm going to be looking inside your nose. Okay, so I look in your nose, I see a little bit of hair which is evenly distributed. There's no drainage, no discharges. It's pink, and the turbinate's a little bit swollen, not much, and the septum is midline, it's not deviated. Okay, so now I want you to just cover one nostril for me and breathe in. Any problems?
No problem.
Okay, do the other nostril. Breathe in, no problems?
No problem.
Okay, just a quick question for you. Do you have any difficulty identifying smells?
No.
Okay, so that indicates that your cranial nerve number 1 is functioning very well. Okay? All right, so the next test I'm going to do, I'm going to check your facial nerves, okay?
Okay.
So I'm going to use this Q-tip. It's going to be soft on your face. I want you to close your eyes. And I'm going to, you tell me when you feel it, okay? So you just say now.
Okay. Now. 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 Now.
Okay. So now I'm going to use a sharp object and touch your face. You tell me when you feel it, and you say now.
Now. Now. Now. Now. Now.
Okay, good. You can open your eyes. Okay, the next test I'm going to do, I'm going to ask you to close your eyes tightly. I'm going to ask you to wrinkle your brow, smile, show your teeth, open your mouth, stick out your tongue. Okay, good. And want you to grimace real tight, but bite on your teeth real hard. Let me feel the muscles. Okay, good. I want you to stick your tongue in the corner of your cheek. I'm going to push against your tongue. Good. And the other side. All right. So just testing your facial, looking at your facial expression as you make these motions to see if there's symmetry. And so far, and now I've tested your cranial nerves, numbers 5 and 7. Okay, 5 and 7. All right. So the next test I'm going to do is check your mouth. I'm looking at your lips. I'm observing them. They are symmetrical. I see no cracks, no lesions, no bruising, no swelling. All right? And they are moist. Okay, so I'm going to ask you to open your mouth while I look inside your mouth. Okay? I look in your mouth and I can see that the oral mucosa is moist and pink. No lesions, no swelling. I'm looking at the teeth. They are white. Just about 2 fillings which are intact. I see that your gum line is not swollen, it's not red, it's not receding. Okay, just say, and the tongue is also midline, a little bit wide on top, which is normal. I want you to lift up your tongue for me and look at the bottom of your tongue. It's pink and moist. Few veins are showing, which is normal. Okay, so I want you to say a big ah. Ah. Okay, so I just observed their posterior throat and the tonsils are not swollen. They are pink. They are moist with no lesions and no exudates. The uvula is also midline, pink, and moist. Okay? So, next thing I'm going to elicit from you is a gag reflex. I want you to open your mouth. I'm going to stick this to the back of your throat. I won't do it hard. Okay, good. You have a positive gag reflex. All right, so I just checked your cranial nerves, numbers 9, 10, and 12. Okay? All right, so the next thing I'm going to do, I'm going to check for your nose at this time, okay? Okay, before I check your nose, I'm just going to be palpating your sinuses, okay? So I'm going to palpate the frontal sinus, and I'm palpating the maxillary sinus. And is there any tenderness?
No.
Okay, no tenderness. Okay, now I'm going to check your nodes, all right? So I'm going to do the nodes here are the pre-auricular, the post-auricular, the occipital. This is the submental, mental, the parotid node. This is the inferior cervical node, the posterior cervical node, the deep cervical node. This is a supraclavicular node. And if you raise your arms, I can feel the axillary nodes. Okay, so you have no nodal enlargement at this time. Okay, so the next thing I'm going to do is to check your neck. I will look at your neck, observe it. So for any swelling, no nodes, no bruising, I look at your trachea, I see that it is midline, okay? So the next thing I'm going to be just palpating your carotid artery. I'm only doing one at a time so as not to occlude the artery. Okay, then I'll palpate on the other side. Okay, the next thing I'm going to be palpating your thyroid. And while I'm at it, I'm palpating the trachea to make sure that there's no deviation and it is no problems there. All right? Okay, so next I'm going to be using my stethoscope. And I'm going to be listening to your carotid artery. I'm going to use the bell of my stethoscope. Okay, I'm listening for bruit. Should not be any. I'm listening the other side. Okay, and I'm also going to be listening over your thyroid. Okay, so far so good. All right, so the next thing I'm going to ask you to do for me is to shrug your shoulders.
Okay.
Okay. Put your head to once to the right. Good. Head to the left. Head to the back. Head forward.
Okay.
Okay, you're going to repeat the same motions while put my hand and you're going to do offer resistance. Okay, shrug your shoulders. Okay, head to one side. Head to the next. To the back. And forward. Okay. So far, so good. And I've just checked your cranial nerve number 12. Okay, so we have checked for all 12 cranial nerve. When I ask you about your smell, we check cranial nerve number 1. Okay?
Okay.
All right, so the next thing I'm going to ask you to do for me is to, I'll check your back. Okay, turn around. I'm going to be checking your back.
Okay.
Come closer to me. Okay, I'm checking your chest, but I'm checking the anterior chest, okay? And for this exercise, I'm going to be first looking at your chest, the back of at your back to see that it is symmetrical. I watch your breathing as you breathe in and out to make sure that your breathing is symmetrical also and it's regular and even, and so far so good. Then I will be just palpating to find if there's any abnormalities. Okay? And one of the things I'm going to be doing is to palpate your your costovertebral angle. I'm checking if there's any tenderness over your kidneys. Any pain there or tenderness?
No.
Okay. Anything here?
No.
Okay, good. All right, so next I'm going to be checking your what we call tactile parameters to see if the sounds are even, the vibration in your chest is even. Okay.
Okay.
So when I put my hand on your chest, your back, you're gonna be saying 99. Okay.
Okay.
Go ahead. 99.
99, 99, 99, 99, 99.
One more time.
99, 99, 99, 99, 99.
Okay. So far, good. Now I'm going to be percussing your chest. I'm going to be listening for what we call resonance, okay? And I'm going to do it between your the ribs, okay?
Okay.
I'm just going to be checking both sides to listen to make sure it's balanced there. Okay, raise your arm for me because I have to check your anterior chest. Okay, so far good. Okay, the next thing I'm going to be checking for to see how well your lungs are expanding. So I'm going to put my hands across your ribs here, and I want you to take a deep breath. And my hand should go up one more breath, okay? And you should see the expansion of your lungs as my hands are pulled apart. Okay. One thing, last thing I'm going to be checking for here is what we call the diaphragmatic excursion. I'm going to be palpating, and when I'm not, I want you to take a deep breath, and as I palpate, I will just palpate to check for that, okay?
Okay.
All right, so you take a deep breath and hold. Okay, good. When the resonance changes to dullness, I'll make a mark. Okay, make sure you breathe. Out, relax.
Okay.
Okay, so take another deep breath. In, out. Okay, take another deep breath and hold. Okay, then I'll start palpating up. And then when I start hearing resonance, I make another mark. Okay, and this is about 3 centimeters, which is normal. Normally is 3 to 5 centimeters. Okay?
Okay.
All right, so next now I'm going to be listening to your lung sounds from behind. Okay, take a deep breath. Okay. Breathe. Good. Breathe. Good. Okay. Raise your arm. Okay. All right, so far, so good. Now I want you to turn around for me. All right. So basically the same thing that I did at the back, I'm going to be doing at the front.
Okay.
I observe your chest for rise and fall. I also look for respiratory rates, see if it's regular and even. I also look at your chest to see if there's any lesions, no bruises, no welts, and so far there is none. Okay, so now I'm going to be putting my hand on your chest, and I'm just going to palpate the areas of your chest. Any tenderness?
No.
Okay, so there's none. I'm going to be asking you to say 99, so whenever I put my hand on your chest, you're going to say 99, okay?
99, 99, 99, 99.
Okay, one more time.
99, 99, 99.
Okay. All right, so now, so far, so good. I'm also going to be palpating the your cardinal points of your heart, and I'm just going to be palpating to feel for any thrills or heaves. Okay. All right, so now I'm going to be putting my hand across your chest here, and you're going to take a deep, you're going to breathe, and I'm going to be watching as my hand expands, and that is checking for the expansion of your lungs while you breathe, and that looks okay. All right, so the next thing I'm going to do, I'm going to be listening to your lung sounds, okay? Okay, take a deep breath. Okay. All right, so one more thing that I really should have done is to percuss your chest. So which I'm going to do now. So we're going to be listening for resonance. Okay. All right, so your lungs are clear bilaterally and no wheezing or anything hurt. Now I'm just going to be listening while you're sitting there. I'm going to be listening to your heart sounds at the cardinal points. Okay, so I'll be listening at the aortic, which is at the second intercostal space of the right sternal border. The pulmonic, which is at the second intercostal space, left sternal border. This is the Erb's point, third intercostal space, left sternal border. Tricuspid, which is at the fourth intercostal space, left sternal border. And the mitral, which is at the fifth intercostal space, mid-clavicular line. Okay, so far so good. All right, so you're going to lay on your back now.
Okay.
Okay, so I'm going to do an abdominal assessment. First, I will start by looking at your abdomen. I'll shine the light on your abdomen to look at the contour of your abdomen, which is rounded. I'm also looking for symmetry, and it is symmetrical. I'm also looking for lesions, bumps. I see here we have a few lesions here which are due to past surgeries, and so far she has no problems. Some scars from surgery. Okay, so come closer to me from okay. All right, so the next thing we're going to do is to the abdomen. We're going to be auscultating the abdomen. We'll be listening in all four quadrants for bowel sounds. Sometimes we can get hypoactive bowel sounds, which could be from obstruction. You can have hyperactive bowel sounds, or you could have absent bowel sounds. So far your bowel sounds are normal. Okay, the next thing we're going to do is to lightly palpate your abdomen. Tell me if you have experience any tenderness. So we do light palpation. Any tenderness?
No.
Okay, so I'm going to do deep palpation. Okay? So I'm going to go deeper. Okay, no tenderness?
No tenderness.
Okay. One of the things I'm going to do here is to also feel the aorta. Okay, so I'll feel here. Okay, it's all good. Also, I'm going to be listening over the aortic, over the aorta for any bruises. I'm also going to listen to your renal artery. I'm going to listen to the iliac arteries, right and left. And I'm going to be listening to the femoral arteries. Okay, good so far. Okay, so the next thing I'm going to do, I'm going to be percussing your abdomen, and I should be hearing tympani over your abdomen until I get to where the organs are. They should become dull. Okay, so now I'm going to be palpating for the placement of your liver. I'm going to start mid-clavicular from your abdomen up. When I get to dullness, I will stop and mark the lower borders of your liver, and then I will start from your chest down to get the upper border of your liver, okay? Okay. I'll mark, and I'll start from above. So we got it here. And this is about 6 centimeters. And it is can be 6 to 12 centimeters, so yours really normal. Okay?
Okay.
Alright, so the next thing I'm going to do is to palpate for your liver. Okay? So I'm going to put my hand behind you, and I'm going to be feeling for the borders of your liver. Okay? And that's how you check. Okay. Alright, so that's good. Then I'm going to be checking for your spleen. Okay? Slightly turn your back. Okay, very good. I'm going to put one hand behind. I'm going to palpate for your spleen. The spleen should not be palpable, and I'm not feeling it. So, which is a good thing. If it was, would have been because it's enlarged. Okay, while you're here, I can also try to palpate for your kidney, which I am not able to at this time, which is a good thing because it would mean that there's some enlargement of your kidney. So far, everything is okay. All right? Okay, so the next thing I'm going to ask you to do, I think we have, okay? So I'm going to ask you to sit up for me. Okay, lay back. One more thing I forgot to check. I'm sorry. I will make sure I get that done. I want you to, as you are, try to sit up. I'm going to check to see if you have any hernias. I can check for that. Okay? So I'll watch to see if there's any
While I'm
bulging.
sitting up?
Just try sit up. Don't sit up, but just try like you're sitting up. Okay, good. All right, good. Back down. Good. Just checking the muscles of your abdomen to see if there's any bulging there. Okay. All right. So far good. I'm just going to check your thighs. Okay, so I'm looking at your legs, and I can see that they are well developed. Muscles are well developed, very good, strong. And whatever hair you have on your legs, they are evenly distributed. There are no lesions, no bumps, no welts. They're very good condition. Just some occasional spider veins here, which is normal. No problems. Okay, can you move your legs? Good, freely. Okay. What about this one? Okay, beautiful. No problem here. The skin is warm and dry. Okay, good turgor. All right. Okay, so now you can turn and sit up for me, please.
Okay.
Alright, so now I'm going to be checking your upper extremities, your arms. And you can feel your arms to they're nice and warm and dry with good turgor. No lesions, no swelling, no bumps. Okay, so I'm also going to check your fingers. Okay, they're good. I'm checking for capillary refill. Okay, that is brisk, less than 3 seconds. Brisk, less than 3 seconds. I'm going to be checking for your pulses, so I'll check your radial pulse. Sorry, your brachial pulse. I'm sorry, brachial pulse. Okay, good. And I'm going to be checking your radial pulse. Okay, good. I'll be checking the popliteal pulses. Okay, it's right and left both present. I'm going to check your posterior, the tibial pulse. And I'm going to check the pedal pulse. The dorsalis pedis, okay? Okay, so far good. Next thing I'm going to be checking your reflexes. Okay? So I'll start by checking the reflexes, the brachia. Okay. Alright, so we're going to check these reflexes here. Okay. Good. Alright, so the next thing I'm going to check is your patellar reflex. Okay. Alright. So now I'll check your reflex here. Reflex here. Okay, so far so good. Okay, so I'm going to invite you to stand for me.
Okay.
Okay, good. I want you to bend forward as far as you can. Good. What I'm going to be checking now is your cervical, your spine. Okay, checking for any tenderness, any abnormalities. Okay, so far so good. Alrighty. Okay, I'm just going to be checking your gait and balance also.
Okay.
So I want you to just come beside me here.
Okay.
Okay, so you're going to be just making a few steps there. I want to see how you walk. But I
Okay.
want you to walk with your one foot before the other, like so,
Okay.
and keep your balance for me, okay?
Okay.
All right, so begin. Okay, you can come back now.
Okay.
Okay, good, good gait, good balance.
Okay.
Excellent. Okay, you can have a seat here now.
Okay.
Okay, so this concludes our assessment, a head-to-toe assessment for the Maryville University Nursing Assessment class. Thanks for watching.